everybody. My name is Barry Hudson. I'm the Director of Public Information, and welcome to our weekly press briefing. I put on my red sweater since we're about to hit the holiday season, just to kind of celebrate that a little bit. But we're doing this a day early because of the holiday, and we want to thank you all for joining us. We're joined by the normal folks who are here with us, the county executive, Dr. Earl Stoddard, and Dr. Travis Gales. I want to remind members from the media, if you'd like to record, please ask for permission to do so. And if you have a question, make sure that you identify what person you'd like to address your question to and what media operation you are with. So without further ado, I will turn over the opening to County Executive Mark Eldridge.
So thank you very much, and I'm very happy to be here this morning, or this afternoon. I guess we've passed into the afternoon now. These are continue to be, I think, very trying times for all of us. I think we're well aware of the challenges that we face, but I'm glad that we're continuing to do these briefings because, you know, COVID doesn't take a day off, and our approach has been if COVID's not taking a day off, we're not taking a day off either. We're going to make sure that we're out there letting people know what it is we are working on and thinking about. So again, thank you all for coming out today. I do want to read a brief statement on restaurants, because we're not going to be answering questions on indoor dining today because of the pending lawsuit. But I do want to say that, as you all know, the action we took to protect public health by suspending indoor dining is now in litigation. As a result of the pending litigation of this matter, we will not be addressing questions on this issue. But I will say is that we absolutely empathize with the hardships restaurateurs and workers are experiencing. Not unlike, frankly, all the other businesses that have been restricted by decisions we've had to make and knowing that there are consequences. We took this step out of grave concern for public health, and we've invested millions to assist our restaurants during this pandemic because we want them to survive. But first and foremost, we have to preserve lives. So we're not going to comment beyond that today, and hopefully the next time we meet, there'll be more we can say. So I want to emphasize a few things as we go into the holiday season. First is, it's really important for us not to gather during holidays other than on Zoom calls like this, or Microsoft or Cisco WebEx. I don't want to do a plug for any one platform. It's really important that people not get together. And if we're going to do what we can to control the spread of corona, we have to be sure that we're able to prevent ourselves from putting each other at risk. The next 2 weeks are going to be critical to bend the curve in the right direction. We've had some improvement. We're hoping that as we go through this and we continue to take the steps we've taken, that we're able to continue that improvement. But all this ultimately depends on everybody out there in the community. You are going to hear an awful lot about vaccines. It's hard to pick up a paper or read an online news story where vaccines aren't being talked about. We just want to make sure that everybody understands vaccines for the general population are still probably months away. They're not coming tomorrow. They won't be here in January. There's a state rollout. It focuses on, the high-risk workers. Dr. Gales or Dr. Stoddard could, talk more about that. But I just want to be sure that everybody understands that as you read the headlines about, the vaccine's here, the cavalry's arrived, the front forces of the cavalry may have arrived, but the guys carrying the big barrels of vaccine, they're yet to come. So it's going to be a while. Last week, we reached a very sad milestone in Montgomery County. We had our 1,000th death of a Montgomery County resident to the coronavirus. This number is alarming, and it's why I'm encouraging everyone to stay home and please celebrate safely during the holidays. I keep reminding people that if we do this right, there are going to be more of us, more of the people we care about are going to be here to join us next year. And so think about not just the moment of what you will get out of a gathering this year, but think of the gatherings in the future and who you want to join you next year and the year after that. And keep that in mind when we're all thinking about our behavior in the coming days. Last week, the governor announced travel restrictions, and he's requiring people to self-quarantine if they do travel. I agree with that decision 100%. And we, along with our neighboring jurisdictions, announced restrictions suspending indoor dining, limiting indoor sports gatherings to a maximum of 10 people, and retailers are required to reduce their capacity to one person per 200 square feet of retail space, not to exceed 150 people. I think you know that the larger stores are allowed to submit a plan, and if we approve a plan, we will allow more than that, but there's no guarantee that just saying I want to do more than 150 people will get you permission to do more than 150 people. And I did a little trip out to Westfield Mall the other day, and I will say that most of the stores had proper lines and had people checking to make sure that folks can come in, but one very big store didn't have any of that, and that was distressing. The crowds in that store were far beyond the limits we have in our guidelines. Dr. Stoddard is going to provide more details on how we're working with retail and on the letter of approval process. I believe our actions do matter, and if we all do our part, we can make a collective difference. Today, our case count was 380. Our positivity rate sits at 6.1, and our cases per 100,000 are 33.3. That's only about 6 or 7 times higher than our rate earlier this summer, or back in the summer, and our positivity rate is still about twice what our low point was. The volume of testing taking place in the county, sponsored testing sites, continues to be very high. Last week, we tested 10,778 people. And I think yesterday we set a record for testing 3,068 people. It's the most we've tested in one day since the beginning of the pandemic. And we're expecting testing volumes to remain high this week in anticipation of the holiday and the new year. We are happy that there is $900 billion in federal COVID relief. It's not enough. It's not enough for the business community, and it's certainly not enough for governments around the country, whether you're a green state or a blue state or a blue county or a red county. All of us are being hammered by the impacts of COVID, and all of us have had to make decisions to preference public safety and public health over business, and that obviously has impacts for income taxes and business taxes, and has impacts for businesses in their ability to pay their rent and pay their bills, and that has impacts when they close on their employees' ability to pay rent and pay bills. I believe the federal government needs to do more. At the beginning of November, apparently they also believe they need to do more, twice as much as what they actually did this time. So we're hoping that there's more relief. One of the really bright spots in this relief, though, is it looks like there's money for transit. And if things pan out the way people are talking about it, there may be enough money in that package for WMATA to avert, the real disaster that was looming for them. I do want to thank our congressional teams for their efforts. Our congressional teams advocated for the right stuff. There are other problems in Congress, and it's not on our team. Although this will help many, it does not go far enough. And so we're going to continue to work and look forward to a new administration, and hopefully getting further progress, making further progress, and making sure that we're ready to rebuild America, not just fight COVID, but make it possible for everybody to get back on their feet when COVID is over. Overall, the new relief package, like I said, is a good start. So I just want to remind people that, our theme has kind of been, we can't stop now. There is a light at the tunnel, but there's a second vaccine that's being delivered all over the country. That's the good news. Again, the supplies of the vaccine being limited is the limitation on our happiness at this point. Hospitals, as well as state and local jurisdictions, have not received the amount of vaccine needed to vaccinate the number of health professionals and frontline workers we have. At this point, the supply simply does not meet demand, and the supply, near as I can tell, hasn't matched what we were told we were going to get. Yesterday, I think President-elect Biden got his vaccine shot. I will be getting my vaccine shot when it's my turn, whenever what category I'm in turns up. I will be doing that. If you remember, testing started this way in the early days of the virus. So, we're used to scarcity, but it would be nice to get beyond scarcity. And just because there's a vaccine, we can't let our guard down. There are a lot of questions around the vaccine, whether or not you can still get mild cases of COVID, whether or not you could potentially still get enough of a case that you could be infectious. These answers they don't have good answers to this right now. Again, if this had been a typical, 2 to 3 year rollout of vaccine, we would know some of these things. We're going to be learning them as the vaccines get rolled out. But they are going to make a major difference in how we protect people and what we're able to do once enough people really get vaccinated. In the meantime, it's imperative to continue to do the things that have made us successful so far. I remind everybody that in the beginning of this, we were on the same trajectory as those states and cities we saw that had that spike line go through the ceiling. And the things we did early and that the governor led on early enabled us to turn that curve down, flatten it, and level it off. We're doing the best we can to take those lessons and at least apply them in Montgomery County and some of the other counties around the state. We know what it takes to minimize contact between people, and we're doing the best we can to make sure that we're able to do that and that our policies support minimizing contact. You need everyone to mask up. We need you to social distance and wash your hands frequently. And these actions are very important in reducing the spread. And I want to say just another note about masking up. Masking up is critically important, but not staying in the same room with the same people for a prolonged period of time is also important, because the virus does linger in the air. And even with a regular cloth mask on, the longer you're in a closed environment, the more potential you have for more exposure to the COVID. So don't linger in places longer than you need to, and certainly not with people you don't know. During this holiday season, I do encourage our residents not to gather. Use Zoom and FaceTime, as I said before, and you see the light at the tunnel. Let's just make sure we all get there. Let's take care of each other. Let's stay vigilant, and let's make sure that we have even a better celebration next year when this season comes around again, and we're not restricted the way we are today. So celebrate your holidays safely. Give the gift of health and life to our friends, family, and our neighbors. Thank you very much, and I'll turn it over to Dr. Gales.
Good afternoon and happy Tuesday. I think this is a first. We're usually either Wednesdays or Thursdays, but regardless of the day, always a pleasure and a privilege to be with you all. I will keep my remarks brief and happy to answer any questions. As the county executive mentioned, our numbers, while they are not near where they were during the post-Thanksgiving bounce, if you will, in surge in cases, they still remain elevated. Where we see a test positivity above 6 and a case rate in the low 30s. So certainly we are hopeful that the interventions and restrictions that have been put into place will continue to drive that curve down. And we are especially hopeful that over the holidays that we won't see a comparable surge or increase in cases that we saw following Thanksgiving. Now, to pivot to the question that I'm sure lots of folks will ask based upon the feedback that we've received so far this week are questions related to vaccines. There still remain a lot of unknowns related to vaccines. So please don't take my lack of clarity or specificity on any of those particular issues as a lack of transparency. We're continuing to learn information on an hourly and a daily basis. As many of you are aware, ACIP guidelines were approved and released over the last 48 hours that give further clarification to categories 1B and categories 1C, with some more information related to essential employees and age limits. So in 1B, it's over the age of 75, and in the 1C category that was announced yesterday, it would include individuals who are 65 and older. We continue to work on and have an infrastructure in place to begin disseminating and distributing the vaccine as a local health department whenever we receive it. We've received some preliminary information that suggests we may be getting 100 doses, or approximately 100 doses of vaccine as early as tomorrow. That amount has not been confirmed and the delivery time has not been confirmed, but our expectation is that if we do receive such a limited supply moving forward in the near future, we will utilize that supply to provide coverage for the team that would actually be helping to stand up the apparatus to provide broader vaccination to the community. Now, I would also like to take this opportunity to clarify a couple things. There have been a lot of healthcare providers who sent in notes. There have been a lot of community folks sending in notes requesting to be considered in those different categories and asking when they can sign up. At this time, there is no sign up, if you will, for the vaccine in terms of getting in line. Our expectation is that, and as it's been communicated from the state, is that the local health departments will serve as a safety net for providers and healthcare workers who are not a part of a hospital system and are not a part of a long-term care facility. And we are working with the state to get further clarification in terms of how those particular groups may be prioritized given the short supply of resources that we have available at this time. We recognize there's a lot of excitement about vaccines coming out. Trust me, we in the public health world are excited about it as well, because that does mean we will potentially be moving to the later stages of COVID-19 response. But at the same time, we encourage folks to be patient and to understand that this is a process that will be followed very carefully by the guidelines put forward the federal level and the state level. And if you do have advocacy related to your particular group, your particular profession, or individually, we would encourage you to share that information to the state as they consider further prioritizations within that. As we continue to refine our message here and get more information from the federal level and state level, we will make that information readily available to the general public to help guide your expectations. I will stop there, but happy to answer any questions you all may have. Thank you. Dr. Stoddard.
Thank you, yes. Good afternoon, everyone. I only have a few updates. As of this morning, we've received 61 letter of approval requests. I believe about 40 of those are from our big box stores seeking a letter of approval in advance of tomorrow's 5 p.m. deadline for having one to allow them to exceed the 150-person limit. At this point, we have not rejected any of the requests, and just so we're clear that we have not rejected any of the letter of approval requests. There are some of the requests that have gotten some feedback, and we'll provide some additional follow-up in terms of expectations that we have of them. As I said to the county council last week, this process will not be a rubber stamp, meaning we do find letters of approval that don't even attempt to get to the requirements that we put forward, or frankly to safe operations. We will reject those. We just haven't done it. We haven't had one that's been reviewed to this point that we've found that necessary. Our goal is to get to yes in as all cases as possible. On the back end of this, talking about enforcement, a couple things. So we have, as we've talked about in recent weeks, we have ramped up our enforcement team. We'll be bringing on additional staff. Our Division of Animal Services will be getting training next week on how to enforce the executive orders from both the governor and the county executive early next week. We brought in some individuals from our Department of Transportation to do more of the education on the front end to make sure that people are aware of the requirements. And early in the new year, we'll be bringing in our Department of Housing and Community Affairs inspectors to increase capacity in a similar way to Animal Services. For those additional enforcements, they're going to integrate it into how they do their day-to-day enforcement for their normal activities. So for Animal Services, they normally would inspect some of the animal providers in the county, but they'll add in additional enforcement, thinking about retail and other establishments that we are concerned about right now. In addition, obviously, in light of the indoor dining suspension, we've been able to redirect some of the enforcement personnel that would have been doing inspections of indoor dining towards other areas like our retail stores where we have some concerns, and we'll continue to do that. One of the positives of having this letter of approval process for the big box stores is that we now also have a plan to which we can hold accountable many of our larger retailers to ensure that they are following what they've told us that they were going to follow. I think we observed over the weekend a lot of stores have taken heed to some of the concerns that we have raised. You did see lines outside of stores, which obviously, with it being cold outside, people raised some concerns about that. But frankly, stuffing all those people that were in that line outside inside the store is not a safe situation either. So we're obviously monitoring that closely, and we'll continue to do so. We appreciate the stores who've obviously heard what we were concerned about and have taken measures to try and make their in-store spaces more safe as a result. The last thing I will touch on is, if you had not seen earlier this week, CDC updated their ventilation and filtration guidelines. I'm extremely pleased to say that they look a lot like what Montgomery County was recommending, a month or 6 weeks ago. We tried to be on the front end of this, and we're glad the CDC is increasing their recognition of the fact that aerosol transmission is a thing, and that how we can protect people in indoor spaces, while not a substitute or a surrogate for the close contact, things around, putting people into tight spaces. They will be important, particularly as we come out of some of these more significant restrictions into the spring, to have indoor spaces be safer as we open them up and consider how they can increase capacity. So with that, I'll stop, and I think we're going to take some questions.
Thank you, Dr. Stoddard. Our first question is from Amy from NBC4. And her question is to Dr. Gales. Amy?
It looks like her mic is broken.
Okay, I'll go ahead and ask her question. Her question was, could you talk about the current status of hospital ICU capacities?
Sure. I can pull up, give me a second here, the most recent information related to it. So our last report that we had, at least documented, we'll get a report later on this afternoon, was from Friday, where we saw one of the 6 hospitals in the red zone, and the others were in the yellow zone. As it related to ICU capacity, 2 of the 6 hospitals did not have any vacancies within the intensive care unit. There were 73 beds occupied by COVID-19 patients in the ICU as of Friday afternoon. And as I mentioned, we'll be getting a comprehensive daily report later on today, but that's where we stood as of the weekend.
I believe this morning that Sean O'Donnell updated. I think the numbers he had were 75. So we've gone up slightly in terms of our intensive care beds. That was the AM update that we received on our call.
Okay, next question is from Rebecca from Washington Post. She has a question for Dr. Gales and for the county executive.
Thank you, and thank you guys for hosting this. My first question is a really straightforward one for Dr. Gales. Do you have a sense of how many people within Montgomery County have been vaccinated so far? And have they all been healthcare providers, or have they also been nursing home residents?
So thank you for the question. It's hard to say at this point, but in terms of approximating the numbers, each of the hospitals within Montgomery County did receive doses of vaccine last week and began the administration process. We estimate that each of them, each of the facilities may have received up to approximately 925 doses. And just by doing the math, multiplying that by 6 different facilities, that could be upwards of somewhere with approximately 5,500 doses that the hospitals received collectively. And anticipating, I'm not sure what percentage of those who did get vaccinated are Montgomery County residents, as that it's based upon the staff in those facilities, regardless of where they live. But I will say on the flip side, related to the nursing homes, that process has not begun. So the vaccines have been shipped to the different pharmacies, because if you recall, the long-term care facilities in Maryland have partnered with retail pharmacies through a partnership to be able to, the pharmacies will distribute the vaccines at those sites and work with those facilities to get their residents and staff covered. So we know that has begun, but we anticipate that the first doses of the vaccine will be administered to those residents and staff the first week of January, based upon the most recent conversation with the state.
Got it. And another question for County Executive Outreach as well as Dr. Gales. You were urging residents today not to travel for the holidays and have been doing so for several weeks. But we've already seen early reports showing that there was record travel across the country as well as in the region this past weekend. And sort of looking at that data now, looking at that news point now, do you think government officials like yourself should have done more in the past couple of weeks to curb such travel?
You know, I don't have the draconian powers that could actually curb travel. We have been very clear about our messaging, even to the point that the governor took to the same message and actually said you shouldn't go out of state. So it's not for a lack of messaging. And I don't think I'd even have the power to do things that it would take to actually stop people from traveling. We're not in a lockdown. So absent doing things like that, you're really limited to encouraging people to do the right thing and hoping they do it. Doesn't always work.
And to build on what the county executive mentioned, I think our job and task is to educate people about the risks and make sure they have as much information as possible to make those decisions. And I think also one of the important messages related to traveling is this: if individuals are traveling, we want them to think carefully about what it looks like when they land. What types of environments are they going in? Are they continuing to wear their face coverings? Are they continuing to appropriately physically distance away from individuals who are not a part of their household? And are they continuing those practices that we put forward that would mitigate transmission as best as possible?
Thank you.
The next question is from Kate Ryan, WTOP. She has a question for the county executive and Dr. Gales.
There we go. Unmuted. All right. Thank you very much. I wanted to ask, I know you can't talk about the lawsuit, but I do want to get to some facts about transmission. There is an argument that you can't prove that transmission happens as a result of someone going to a restaurant. And there's the argument that if you keep restaurants closed, people will gather privately, and that will spread the disease even further. Can you comment on the facts of both assertions?
I'm not going to comment on much beyond that. There's a court case tomorrow, but many of these things will be discussed. I think there is a body of literature that does provide further insights to the questions that you asked in terms of the facts that actually does confirm that there is the possibility of transmission in those settings. But there is no literature that I'm aware of, and looking to Dr. Stoddard or the county executive, that suggests that by closing those venues that would increase those types of activities that you mentioned. I think we do have a body of evidence because the restaurants were closed at a point during the pandemic response earlier to indoor dining, and then there were different levels of how that reopened. And so I think, without being cagey or intentionally not answering your question due to the ongoing case, I think there is a body of literature that would provide further evidence to address the questions that you asked.
And I asked because, Dr. Stoddard, you said prior to Thanksgiving, I remember you were adamant that dining together is a high-risk activity.
Yeah, I mean, that's a nationally accepted. We could point you to numerous CDC scientific studies that have shown the risk of, I mean, it doesn't, there's a fair bit of this that's common sense. If you're indoors, it's riskier. If you're with people that aren't part of your immediate traditional household, it's riskier. If you're doing anything for extended period of time, it's riskier. And if you're doing it without a face covering, it's riskier. So when you align all those things together, that's how you get to the question of what are some of the highest risk activities, and that's speaking broadly. And so absolutely, that's not Earl Stoddard saying that's not Dr. Travis Gale saying it. That's CDC and others have pointed out that those kinds of activities are the riskiest activities that we can engage in. And just to add to what Dr. Gale said, I think you can follow the timelines of the actions that the county and the governor took in the spring, and you can track our curves and the curves of the state on what happened in the 2 to 3 week period after each of those actions. You can see, if you looked at our curve in Montgomery County and you said, I wonder when they close things and I wonder when they open things up, you can track those points on our curves and understand exactly what, when you made those decisions based on those realities. And so that's speaking broadly. That's not specific to any particular industry, but you can see in our curves when certain decisions were made to close and what they did, and you can see when certain decisions were made to reopen and what that did. And so we don't have to necessarily speak in sort of the abstract. We've got some evidence from what was done in the spring on what happened when we did certain things. We did not see a huge rise in cases after we closed things down because people rushed to do things indoors in their own homes.
Got it. Can I do a follow-up that is not on a legal question, but one that is this morning, Baltimore County executive put a cap on the fees that dining apps can charge. And apparently that's to hopefully, boost the revenues for restaurants and also, allow people that ability to order out and feel better about the restaurants getting more. Is that something he let you know about? Is it something the county will consider?
I didn't know about it, that it was coming, but it's certainly something worth considering.
Got it. And then lastly, if I can, we have one of the county operated liquor stores closed due to a positive test by an employee. My understanding is the employee was last there on Thursday. The county found out about it on Saturday. Can you talk about the tracking of that and whether or not anybody might have been exposed within that time frame? And how do the other stores look right now in terms of opening and safety?
So the current investigation is ongoing, and we're not at a place to release any of that information publicly at this time. If there is deemed to be potential risk to any customers, we will release that information and let them know in terms of a potential exposure period. So please stay tuned. And as it currently stands, I am not actively aware of any other active investigations regarding any of the other alcohol stores throughout the county.
Yeah,
Thank you.
I would just add that we've been on the very forefront. Obviously, we're one of the only counties that operates liquor stores in the way that we do. And so obviously we've been very aggressive in not only making notifications when we have cases, but doing closures and other cleanings and other extended things. I think you would be incorrect to assume that other retailers, private retailers, aren't having the same or more cases. We're just being a bit more overt about it when we have a case, closing the store down, cleaning and doing those things. So I think I would say that our residents, as it relates to our county liquor store, should take some confidence that we're taking it as seriously as we can in terms of making sure that the spaces are as safe as possible for when they are open.
Thank you.
I think Amy's mic is still not operating, so I'll go ahead and address her question. She wanted to do a follow-up, Dr. Gales. What are the two hospitals that had no ICU vacancies?
We can, again, I'll get the daily report this afternoon and can provide that. I think it would be more germane to say where the hospitals stand right now as opposed to where we were for the weekend. So please stay tuned and we'll provide you with that information.
Next question is from Brianna at the Bethesda Beach. She has questions for all three. So go ahead, Brianna.
Yes, thank you for being here, and Merry Christmas and Happy Holidays to everyone.
You too.
Thank you. So for Dr. Gales, I know that you mentioned that 100 doses might be coming to the health department, and that those might be used for people who will help set up the vaccine distributions. Does that specifically mean the health department staff, and will you be receiving it as well? And will you potentially be receiving it publicly so that the media can document it? And for Dr. Stoddard and County Executive Elrich, if you could just address the status update on the FEMA reimbursements, how much the county has received so far, how much it is submitted, and if there will be any submissions that will be made before the end of December, and as well as where are we and how much money could be potentially be unspent. I know that the staff estimated how much could be left unspent out of certain specific appropriations, but is there any money left on the table outside of those?
Two great questions. I'll take what I think is probably the easier one of the two. So thank you, Brandon, for the question. So I think the first question is, you're right. We're speculating to get about 100 doses, which, just to be perfectly candid, is not even a drop in the bucket of what would be needed to cover our healthcare workers, and in terms of what we're hoping to be able to scale up to be able to provide hundreds, if not thousands, of vaccines in the very short near future to all of those folks involved in those different categories. So the expectation is that, yes, there will likely be some staff within the public health response team who are included in that. Again, as we think through how we will staff up and provide the vaccines to all of these different groups. And there's a very good chance that I will likely be included in that group. And if we do find out in enough time, because again, when I say we're finding out things on an hourly basis, we are literally finding out things on an hourly basis. And so if we do get enough advance notice about when they will be delivered, we will let you all know so that some type of reporting structure and Barry and the comms team will handle that, will be allowed. Stay tuned.
Second question you had related to the FEMA reimbursements and the intersection with the CARES Act, the Coronavirus Relief Fund. Well, first off, I think that obviously we received some extremely good news with regard to the congressional action yesterday, which did include a calendar year plus 1 day extension of the Coronavirus Relief Fund spending through December 31st of next year. Obviously, that helps us in large part so that, number one, there would not have been any unspent funds had we gotten to December 30th of this year. But obviously, in light of the fact that we have an extra year, now what we can do is continue the mission that we had discussed with council and that we have discussed with you, whereby we seek FEMA reimbursement for everything that we possibly can, and then whatever FEMA declines to cover, that's what will be billed towards the CRF funds, and therefore maximize the dollars that are brought into Montgomery County for both purposes. As of today, we've submitted $64 million. We will have another submission before the end of the year, likely to be, my staff said by the end of this week. I was being generous and saying you guys can wait till Monday if you want to take the holiday off on Friday. I thought that was reasonable. So we would expect to have another, I believe, $26 million will be going out the door. And then we have some additional funds that next week that we're going to be working on. I don't know that I don't know that we'll have two submissions before the end of the year, but obviously with the congressional action, we can afford to take a little bit more time to be as precise and maximize the dollars that we can get. We're not going to extend this out, and we're not going to punt this till the end of next year and be facing those same timelines. But we are afforded now at least a few extra days and weeks to try and get as much of those dollars reimbursed as we can. On the submissions that we made so far, the first submission, obviously, we got good feedback for the first round of reviews. They had a couple questions, very small details about addresses where things were delivered or being stored. We provided those today. So now FEMA has all of the information they need for the first submission. We actually had a meeting with FEMA today at 11 o'clock to discuss a number of these items. On the second submission, which was largely personnel costs, including significant portions of the COVID differential that has been much discussed. FEMA gave us some really good feedback on some of the narrative that we need to provide to clarify exactly how those personnel were operating. And so they're going to provide us some additional detail. That submission included personnel and differential costs for four of our larger departments: fire rescue, police, DOT, and health and human services. And so received a formal feedback on that, but they did give us their initial, here's the additional documents that we may need in terms of narrative to explain what each of the people were doing. As we discussed, I think the personnel costs are obviously the most challenging for FEMA to review, particularly around what is eligible emergency response work and what is not. And I think that's where we got good clarification today moving forward. So we haven't received a formal feedback on that second submission yet, but I think as FEMA said today, their goal is to get to yes, and we appreciate that.
And, I think Dr. Gales and Dr. Stoddard answered most of this. I just want to reinforce that the decision to extend the reimbursement or the period for CARES, we would have spent the money out, but we may well have spent it out on things that were eligible for FEMA reimbursement. And obviously, well, not obviously, but so if we'd used the FEMA reimbursement, if we use the CARES reimbursement, that's not eligible for replacement with FEMA dollars, where if we use our own money, that is eligible for replacement by FEMA dollars. So we have been very, very careful because our needs are not going to end on December 31st, and there is not a huge tranche of money coming to local governments to do the same kind of work we did before that didn't make it through through Congress this time. And so I still have a lot of people who need food. And I'm going to more than likely have, more people who are going to need rent assistance. We're going to have more businesses who need business assistance. So to the extent that we can figure out every dollar in our budget that right now that's eligible for FEMA, that lets us carry more money into 2021 that we can use to meet some of things that we know for sure are going to be 2021 costs that the county is going to engage in. And it would be great if the new administration follows the path that was provided in the beginning, where we actually can get assistance for doing some of this. But in the meantime, we're making sure that we maximize the use of the county dollars. Once I spend the CARES, if I spend it on something I could have gotten reimbursed for by FEMA, that money is gone. And our needs are too great and far greater than our resources for us to take a chance on spending something we don't have to spend.
Great, thank you. And if I could just clarify really quick with Dr. Gales, you mentioned that health department staff could be included in the first initial 100 doses. Our nonprofit partners who have had staff helping with different county efforts, could they also be included in that initial 100 doses?
Yeah, so when I mentioned that first 100 doses in terms of the vaccine teams that will be helping stand that up, that could include some folks who are volunteer staff within that. But again, the priority will be, again, given that it's only potentially 100 doses, is that we will try to get as many people who will be a part of that process standing up and disseminating the vaccine to other folks within those early categories, to get as many of those folks covered so that as the volume of the vaccine comes in, we can stand those clinic sites up quickly so that we can begin the dissemination process to the broader groups.
Great, thank you so much.
All right. I don't see any more questions. I'll do the normal count, going once, going twice, 3 times. Before we close out, I just want to say a couple of things. Number one, as we approach the last couple of days before Christmas, make sure you shop local and support Montgomery County businesses during that time period. And as our indoor dining is not operable, make sure you let folks know that they can go to MoCo Eats as well as to the MoCo Marketplace to find places where they can either buy food or buy things. So support local businesses during this time period. And as a reminder, well, not as a reminder, to let you all know, next week, our press briefing will be on Tuesday, December the 29th. And instead of starting at 12:30, we will start at 12 o'clock. So happy holidays to everyone. Be safe. Please don't gather, as the county executive and everyone has said, and enjoy the holiday season. Thank you very much.
Thank you all.
Thank you. Happy holidays.